An audio lecture. So the last part we have to look at in chapter 7, and then we've covered like the whole, every bone in the body is basically just the lower extremity. Okay, and there's a couple things that I just want to point out as we kind of move through of just differences between the lower extremity and upper extremity that are important just to kind of remember. Okay, so the first thing you want to do is you always want to just make sure you know kind of what all the basic bones are. And again, we're going to talk about the pelvic bones, and you want to make sure that you know that that upper part of my leg is the femur, the lower part is going to be the tibia, the fibula, and then we're going to look at each kind of all the landmarks at the proximal and distal parts that you guys are responsible for. But first, just start out and be like, okay, do I know what the main bones are that kind of make up my lower extremity? And one of the things you can notice in this picture, and one of the big differences between the upper extremity and the lower extremity, is that we have this girdle, right? But in the upper extremity, the girdles are kind of separated. So my scapulas and my arms are not really connected. They're only kind of connected by my sternum. When you look at the lower extremity, we create these girdles with these pelvic bones and with the femur. But these pelvic bones are actually connected. So what you want to realize with this is that one leg is really going to have a big influence on the other leg, okay? And anything you do on one side or any injuries you have are going to have a big effect on kind of what's going on with those joints on the other side too. So here's a picture just to kind of show that is here I've had my scapula and I put my humerus in there and I create the shoulder girdle, but these are only connected kind of in the front by that sternum, and they have a lot more freedom of movement where I can kind of move the one side without really affecting the other side. That's impossible in the lower extremity because again, these two bones would be connected. Any movement I do on the one side is going to affect the other side a lot. Okay, so now we get to those hip bones. And again, we're really talking about this pelvic girdle, okay, or this hip girdle. It's going to be formed by the sacrum and a pair of hip bones. They're going to attach to each other anteriorly, okay, so that's what we just talked about. And then they're going to attach to the sacrum posteriorly. They're going to link the lower limbs to the axioskeleton. Okay, so and another big thing to remember with the lower extremity is that it's bearing a lot of weight. Okay, so it says it transmits the full weight of the upper body to the lower limbs. This is why the bones in your lower extremity have to be so bigger. The ligaments are going to be bigger. Everything has to be kind of bigger and stronger. We're going to secure this part to the exoskeleton again through these very strong ligaments. We're also going to have deep sockets in your hip joints to kind of firmly secure the head of the femur in place. A little bit different again from the upper extremity where we talked about the shoulder joint and how the humerus kind of sits in a shallow socket to create this maximum amount of motion. Hip joint going to be a little bit different, okay? It's going to have a very more kind of stable joint. There's going to be a lot more ligaments, a lot more bigger muscles surrounding there. So we're going to lose a little bit of mobility in the hip, okay, compared to the shoulder, but we're going to have a much more stable joint. And again, we need this because of all that extra weight and all those forces that hip joint has to sort of absorb. So now we get to the bones here. So we have the fusion of three bones. You have the ilium, the ischium, and the pubis. The ilium is going to be the large flaring bone that forms the superior part. The ischium is going to form the posterior or the inferior part, and then the pubis is going to form the anterior portion. Okay, we're also going to have an acetabulum, which is going to be kind of like the socket that femur is going to sit into. So it's a deep socket on the lateral surface of the pelvis, and it's going to be the one that kind of receives the head of the femur. Okay, so here's a picture of all the things that we just talked about. So you have our two pelvic bones, and again, they're going to be attached anteriorly to each other, and in the back, they're going to come up and they're going to interact with my sacrum, or the bottom part of my spine, to sort of form these joints in the back. Okay, so make sure you can label ilium, make sure you can label the pubis, make sure you can label the ischium, and again, you want to remember that pubis is going to be a little more anterior, and that ischium is going to be a little bit more posterior, especially when you look at it from the side. So here is a picture of those two bones when they've been kind of separated. And again, these are good ones for your practical too. And again, very important to remember, okay, ilium, pubis, and the ischium. And I always remember this one by just remembering that the pubic bone is kind of pointy. And I always kind of remember the anterior versus posterior, where you think about, I'm going to sit on this ischium and I'm going to have this ischial tuberosity, which is the part that kind of most of us are sitting on as you're probably watching this. And you want to remember that it's, it would be very uncomfortable to kind of have to sit on this pubis bone or this pointy bone all the time. So you want to remember this will be nice, much easier to kind of sit on, much more comfortable. So this always helped me to remember that ischium is going to be towards the back and that pubis is going to be kind of towards the front. Okay, but this is important because we have other things to label where we have to find the front or the anterior and we have to find the posterior. So if you look at this little crest up here, okay, which is on your landmark list, we're going to end up, if we follow the crest, we're going to end up with this anterior superior iliac spine and this posterior superior iliac spine. So these are kind of like the anterior one would be those bony spots in the front part of your pelvis, and then the posterior part would kind of be those dimples in your back where people kind of reach back and they put their thumb kind of right in that dimple on their low back. That's going to be this posterior superior iliac spine kind of interacting with that sacrum. But again, we have to label these. So when we get this pelvic bone here, we have to find the front and the back. So the pubic bone kind of shows you, okay, this is anterior, so I know this is the anterior superior iliac spine, and I know that the ischium is posterior, so that's going to help me know that this is the posterior superior iliac spine. So for all these bones, the very first thing you want to do is just orientate yourself. Find the front, find the back, find the medial side, find the lateral side, and then I can go about kind of labeling things. The other thing that's going to help you sort of know that this is lateral is that I can see the acetabulum here, where that femur is going to go. If I'm looking at it from the medial side, I'm not going to be able to see that acetabulum. So we want to remember that those hip joints are going to be on that lateral side, or they're going to be towards that outside. So here's a picture of the female and the male pelvis. And we used to have this in chiropractic school where they'd put one on the table and you had to kind of tell them, hey, is it a male pelvis or a female pelvis? But you can see that the female pelvis is a little wider, and that's really just to sort of accommodate for childbirth. But what it also does is it makes my hips a little wider, and it's going to change that angle of that femur as it's going down and kind of forming my knee joint. And this is one of the reasons that, like in soccer players or any sports where females have to kind of stop and start and change direction, those knee injuries are really, really common because just that different angle of that femur loads up the knee a little bit differently and puts a lot of stress on those ligaments. So a lot of those injuries or things that we kind of find as we sort of look at, okay, why do these things happen in certain sports, are going to just come back to these basic anatomical or these physiological things. Now we get to the lower limb. So with this one, we're talking about the thigh, the leg, and the foot. Most of us, when we think about the leg, we think about the whole leg. But you want to remember that the thigh is going to be the femur, the leg is going to be that tibia and that fibula, okay? So just the bottom part, and then we're going to have our foot, okay? So it's carrying the weight of the entire erect body, subjected to exceptional forces, okay, when we run and jump, which is why they have to be so thick and strong. So the bones are thicker, stronger than the upper limbs. And again, we're going to have three segments: the thigh, which is the upper part, the leg, which is the lower part, and then the foot. And again, with these, you want to try to find similarities between the upper and the lower extremity. So my femur is going to be very similar to my humerus, right? My tibia and my fibula are going to be very similar to my ulna and my radius. A lot of the bones in your foot, the names are just going to change a little bit. So try to use those similarities so there's not so much more for you to memorize. So we want to look at the thigh, which again is the femur. So this is my largest, longest, and strongest bone in the body. Accounts for approximately a quarter of a person's height. This has always kind of amazed me that kind of that one bone is going to account for so much of a person's height. Surrounded by bulky muscles. Approximately, it's going to articulate with the hip bones, okay, to form my hip joint. And then distally, it's going to articulate with that tibia, and it's going to form my knee joint. These are two very, very important things for like these whole chapters of just thinking about bones, and kind of, you know, the proximal and the distal comes up a lot, and you want to kind of really think about, okay, I have this bone, proximally, what joint does it form, or what does it articulate with? Distally, what joint does it form? So with the femur, you want to really, really remember that that proximal or that top part is going to make my hip joint, and that distal part is going to be part of making my knee joint. Okay, and then we can do that kind of with every bone, and it's a good way to kind of think about things and piece everything together. So here is your proximal femur, and these are all the little landmarks that we want to make sure we know. You're going to have the head, you're going to have this fovea capitis, which is going to be just a pit in the head of the femur where we're going to have this ligament that allows me to attach it right into the socket or right into that acetabulum. I'm going to have a greater trochanter. I'm going to have a lesser trochanter, again, very similar to the humerus, except that I get a tubercle, right? And then I'm going to have, again, the trochanters are going to be just where I'm going to attach a lot of these different little thigh muscles. So here is a picture of our proximal femur. And again, I want to really be able to kind of list everything. So I want to think about what is he going to ask me if he gives me a picture of that proximal femur. So it's going to be those trochanters, right? Greater, lesser trochanter. You have the head, you have the fovea capitis, and then you get that neck in there. When we move to the distal femur, again, we're talking about, I'm creating this knee joint, right? So the distally, the femur is going to broaden to form our lateral and medial epicondyles. So again, it's going to widen out, and then we're also going to form these lateral and medial condyles, which are going to be the joint part. So very important multiple choice question is, my epicondyles are where it widens and I attach my muscles. My condyles are the parts that are covered in cartilage and going to actually form that joint for me, okay? And then again, it's going to articulate with the tibia. I'm forming my knee joint. You're also going to have this patellar surface, which is this anterior smooth surface between the condyles. It's going to interact with the kneecap or the patella. Your patella is going to be termed a sesamoid bone, another good multiple choice question. And all that means is that it's a bone that's going to be enclosed in a tendon, okay? But that's the one that most of us kind of know about. We're also going to have this intercondylar fossa, which is a deep fossa on the posterior aspect of the femur. So we want to look at the picture, and then we want to find all those things. And again, it's going to be really similar to that humerus. So we're going to have this widening that's going to form those epicondyles, and then we're going to have our condyles that are going to form the joints for me. And you can see in the picture just how smooth these are, where they look like they're going to move really smoothly over top of another bone. And again, you want to remember that these would be covered in hyaline cartilage. So now we move down to the leg, or the tibia and the fibula. So just the lower part of that leg. My tibia is going to be medial. Really, really important to remember that the tibia is medial and the fibula is going to be lateral. Again, kind of like up in the forearm where we had the ulna and the radius, and the ulna was medial and the radius was lateral. But this is going to, again, help me with my labeling. So tibia is going to be medial. This is the part that most of us think about as our shin. And the fibula is going to be lateral. There are two parallel bones between the knee and the ankle. Just like the forearm, they're connected by this interosseous membrane. They're going to articulate with each other sort of proximally and distally. And then there's essentially no movement between these two bones. We've created this real strong, kind of stable limb, okay? And you'll see that in the picture here too. So my tibia, again, is medial. Proximally, it's forming my knee joint. Distally, it's going to form my ankle joint. My fibula, okay, proximally does not contribute to the knee joint. And distally, it's just going to help me stabilize my ankle joint. So this is another big difference between the upper extremity and the lower extremity, is that in the upper extremity, we had my ulna, and it was really big where it interacted with my humerus and formed my elbow joint. But at the wrist, it really didn't do that much, right? My radius came and was wider, and it sort of formed my wrist joint. In the lower extremity, because I have to absorb all this weight, okay, I want to keep everything really stable. So my tibia kind of does everything. So my tibia kind of interacts with my femur to form my hip joint, or I'm sorry, my knee joint, and then my tibia is also going to interact with my ankle bones, and it's going to form my ankle joint. And the fibula is going to kind of be more of a stabilizing bone, but it's not going to play a huge role in either joint. Okay, so this is again just one of those things that's a little bit different, and it's just because I have to bear all this weight in my lower extremity. So we look at the proximal tibia. It's going to receive the full weight of the body from the femur, transmits it to the foot. So proximally, it's going to be a little more broad. We're going to get these medial and lateral condyles. They're going to be separated by this intercondylar eminence, okay? And then we're going to have also this tibial tuberosity sort of proximally. So that's this big bump on the front part of just below your kneecap. You can follow that tendon, and you can find this big, huge bump on that front part of your shin. And that's going to be the attachment for that patellar tendon, or the tendon coming from your quadricep muscles. But it's, again, just a really distinctive kind of landmark that you want to be aware of. So here is a picture of my proximal tibia. And again, I'm forming my knee joint. So my femur is going to come and sit right on top of here. But I get my condyles, okay? And you can see those little eminences here. And then I can see that big bone, that big bump in the front part. That's going to be that tibial tuberosity. And I can also see that here's that fibula. And again, it's going to let you know that this is lateral. So this is going to help you sort of know that this is the lateral condyle, because the fibula is on that side, and this is going to be the medial condyle because I don't see that fibula. So you want to use all the things that will help you sort of orientate yourself and know which side is medial versus which side is lateral. So now we get to the shaft and distal tibia. The shaft is not covered by muscle. This is going to form our shin, and this is why it's so painful when you hit your shin, is that there's nothing kind of protecting that bone. And again, we know that the bones are really, really sensitive. So distally, it's going to articulate with the talus bone of the foot, and again, I'm creating my ankle joint. But you have the two bony spots on each side of your ankle, okay? And the medial malleolus is going to be the one on the inside, and it's going to be part of that tibia, okay? And then on the lateral side, you're going to have your fibula. You're going to get this lateral malleolus. So you want to, at the bottom part of by the ankle with the tibia and the fibula, there's not a lot of landmarks I can ask you. So those malleoluses are going to be the ones that are going to end up on your exams. So here are my pictures here. And again, we have our tibia making our knee joint and our ankle joint. So distally, it makes that ankle joint, interacts with all those bones in my foot. but I get this medial malleolus, okay? And then with the fibula, it's on the lateral side. So that big bump on the lateral part of your ankle is going to be that lateral malleolus. So here is my fibula. Proximally, again, it's going to articulate with the lateral side of the tibia, but just adding some stability. Distally forms that lateral malleolus, going to add a little bit of stability to my ankle. Your fibula does not bear weight, okay? But it is a site of muscle attachments. This is an important part too because you can get these little fractures. Like for me, I actually fractured my fibula when I was playing hockey when I was a little bit older. But because it doesn't bear weight, they can sort of put it in a splint instead of a cast or instead of sticking it in this big boot because you won't disrupt that healing process all the time. So it's one of those things where, this kept me from having to wear a big boot and that made where I could still drive and kind of get around and work and do things because I wasn't in this big cast. But again, that's only because it doesn't bear weight. If you had fractured the tibia, it's a whole other story. And then again, you're going to have to kind of stabilize that joint and kind of have no weight bearing until it's had a chance to kind of heal. Now we get to the foot, and again, very similar to the bones of my hand, composed of the following bones. You get the teres, the metateres, and the phalanges. You have two important functions. Again, they're going to support the body weight, and they're going to act as a lever to kind of propel the body. And again, the forces created in your ankle and sort of by your foot are really, really, really high. You have segments of the bones to perform these functions, and this is going to give my foot a lot of flexibility. So because I have all these little bones that make up my foot, I get a little bit of motion between all these bones, and it gives me a lot of sort of movement and a lot of flexibility. Okay, but the ankle is really, 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 really tricky, and because it absorbs so much weight and it acts as a lever, it's actually when you start to have issues with your ankle, it can be really, really difficult to fix because it's not just one big attachment, it's all these little parts, and once you start to break bones or fracture bones, it's really, really hard for them to find a way to sort of fix and get things to kind of work together properly. So here are my teres, or my 7 tarsal bones. They're forming the posterior half of the foot. Majority of the body weight is supported by the 2 largest parts of these bones. So you have your talus that articulates with the tibia and the fibula, and then we have our calcaneus, which is one that most people kind of know about, and this is going to be my heel, and this is going to be the part that kind of touches the ground. So your Achilles tendon is going to attach the posterior calcaneus. Your Achilles tendon is just that big tendon coming from your calf muscles attaching to that back part of your heel. And then we have a calcaneal tuberosity that's going to be the part that touches the ground. We also get these other tarsal bones, so we get a cuboid, we get a navicular bone, and then we get all these little cuneiform bones. And we'll see the picture here in a second here. But you want to think about it as, hey, if I took the tibia off and I just look right down on my foot, this is the bone that the tibia is going to sit on. So this is the talus, and then I can see my calcaneus here. And then I get all my other little tarsal bones. So my navicular bone, I get all my cuneiforms, and I get my cuboid. You can always remember that the cuboid's kind of lateral because it's going to follow that sort of pinky toe here, okay? And then the medial, and again, I get a lot of questions on how do I know what's medial versus lateral, but you want to look at, okay, I know my little toe is the most lateral, and I know my big toe is going to be the most medial, so it can help me kind of label the other bones, right? Because this is going to be medial, so it's going to lead up to that medial cuneiform, and my pinky toe is going to be more lateral, and it's going to be the one that kind of comes up and interacts with that cuboid a little bit. So you want to use all those landmarks to kind of help you label all these bones properly. So we want to find, okay, tarsal bones, metatarsals, phalanges, just like in the hand. And then we want to, again, just make sure that we can label all these little tarsal bones here. So now we get to the metatarsals. So it consists of 5 small long bones called the metatarsals. Just like the hand, we're going to number them from 1 to 5. We're going to begin on the medial side. So it's going to begin on the side of the big toe, just like when we talked about, we started with the thumb. The first metatarsal is going to play a very important role in balance, okay? And the distal end is going to form the ball of the foot. So we'll come back and see that in a second here too. My phalanges are going to be my toes, just like my fingers. You have 14 phalanges, okay? You have 3 phalanges in each digit except for the big toe, which is called the hallux. Just like the thumb, for the big toe, you're only going to have a proximal and a distal one. So we come back to this picture. We find all the tarsal bones. We find our metatarsals, okay? So 1 through 5, starting with the big toe. This would be where we're forming the ball of the foot if we're underneath the sort of the distal part of these metatarsals. And then we get into the phalanges, and we have a distal, a middle, and a proximal, except for the big toe, which is only, again, going to have a distal and a proximal. So here is our picture from the side, and again, I want to make sure I can label all these bones from every different direction. But from this one, when I see these, the very first thing I want to do is think about, am I looking at the medial side or am I looking at the lateral side? And the way you're going to know that you're looking at the lateral side is, again, you're going to look for this little toe, okay? Because I know the little toe is lateral. That's going to help me know that this is the cuboid, and then I can name everything else. If I'm looking at this side, I can see this big arch here, and I can see my big toe, and then that helps me know that, okay, the big toe is medial, this is going to be that medial cuneiform, and then I can go on to kind of label everything else that I need to sort of find. So again, orientate yourself the very first time you look at the picture, and then kind of also labeling things in the same order all the time helps a lot too. So if you start with the things that are easier, and then sort of add in the things that are a little more difficult, that can make it easier to remember too. So we also have, this is the last part of chapter 7, we have these arches of the foot, and they're going to help us with our weight bearing. So we have 3 arches. They're going to give me some strength. Again, their main job is to help me distribute the weight that's being absorbed in my feet along the whole foot instead of in one part. A lot of people, if they have flat feet or they have arches that are real rigid or just feet that are real rigid, they're going to actually absorb a lot of that weight and a lot of that force in one spot, and they're going to be prone to a lot of kind of different little fractures and stress fractures and sort of injuries in the feet because they're not properly distributing their weight. They're just loading up to one spot all the time. So the way we do this is we have 2 longitudinal arches. We have 1 transverse arch. Okay, the arches are maintained by the shape of the bones, ligaments, and tendons. This will change over time too, where a lot of people feel like, oh, my feet get bigger as I get older, but what really happens is you're just kind of losing that arch and your feet are getting a little flatter and you're sort of lengthening that foot up instead of sort of arching it and making it a little bit shorter. But these are going to help me to also have a little bit of springiness in my foot. And this is the picture of all the arches. Okay, so I get the 2 going this way and I get 1 going the other way. And the main reason I bring this up, because we're going to come back and sort of talk about the arches and plantar fasciitis and all the injuries in the foot as we get into the muscle chapters. But again, we're trying to distribute all this weight on this little arch here. And this is something that I see all the time. So we treat a lot of people that have plantar fasciitis or they have, pain on the bottom part of their foot. And most of the time what happens is they come in and what's happened is that their doctor has kind of stuck them in this little boot, okay? And they've been wearing this boot for a long time, but the bottom of their foot kind of never gets better. And this is one of those things where, if you kind of understand the way the ankle works and as kind of the toes work and where the muscles are attaching and what they're sort of helping with, you sort of figure out that, hey, it doesn't make sense to kind of put yourself in this boot and think that it's going to kind of help your foot, okay? Because what happens is, like, this boot is holding my ankle in this kind of neutral position, okay? But the muscles that work on my ankle are actually way up here in my lower part of my leg, okay? And the muscles that are irritated with plantar fasciitis that are on the bottom of the foot, they're actually controlling my toes for me. So if I only wear a boot to sort of keep my ankle in this position, it really doesn't have any effect on the bottom part of my foot. So again, it comes back to just knowing your anatomy and knowing what muscles and joints are responsible for certain movements. So what you have to do for plantar fasciitis is you're trying to stretch out the muscles on the bottom part of your foot, okay? And so these toes, the muscles on the bottom of my foot, what they do is they kind of curl my toes down. So you can see in this one, my toes are really not in any position that's going to lengthen that muscle up. So what you do is you have to use something like this. So this is a sock that they make that you would kind of wear at nighttime. And so you can see where I have this little strap on here, and what it does is it pulls my toes kind of up to my shin, but it stretches this muscle on the bottom part of my foot. And then what happens is you leave it kind of in that position overnight, and slowly that muscle is going to lengthen, and it's going to get a little looser, and it's going to kind of take a lot of stress off of that bottom part of the foot. And you have people that they've worn that boot forever, and it never gets better. And then you switch them over to where they use the sock, and they're actually working on the proper muscles, and they're kind of putting the joints in positions that kind of alleviate that tightness in that bottom part of the foot. And then they do sort of much better. So it's one of those things where, again, if you come back to just the basic anatomy, you know your structures, you know what's responsible for different types of movements, when you're trying to fix things and you're trying to get things to do a little bit better, you can choose things that are going to make a little more sense. Okay, so that is the end of our Chapter 7 audio lectures. The next thing we're going to do is move on to Chapter 8, where we look at the joints, and then we'll come back and we'll look at Chapter 6, which is, again, all our physiology.